Good morning, afternoon, or evening, everyone. Sarandang. Today, I'll be discussing a very relevant topic in the healthcare industry, which is nurses and engineers in healthcare technology innovation. As we know, technology in healthcare is evolving quickly, from artificial intelligence to wearable devices, digital records, and more. But an important question we should ask is, who should lead this innovation? Should it be engineers who have the technical expertise or nurses who work directly with patients and know the clinical side of care? This presentation explores both sides and considers a balanced solution. So let's start with the purpose of the discussion is to present two perspectives, which are first, one that supports collaboration between nurses and engineers, and another that suggests engineers can lead innovation independently. Ultimately, the goal is to explore how we can best improve patient care and healthcare system efficiency by understanding the strengths and challenges of each approach. Let's go on with the introduction, why this matters. The text starts by pointing out a common problem. Nurses are often missing from health tech innovation, even though they are the ones on the front lines of healthcare every day. They see what works, what doesn't, and what patients truly need. In contrast, most health technologies are created by engineers, people who have excellent technical knowledge but may not fully understand clinical environments. This gap between the developers and the users of the healthcare technology is at the core of the issue. Now, let's look at the first main argument, why nurses should be involved in healthcare innovation. There are several key points here. First, from line experience. Nurses are directly involved in patient care. They understand clinical workflows and daily challenges. This gives them insights into what tools are truly needed and how they should function. Second, designing better tools. By involving nurses, we can develop technologies that are more practical and user-friendly. Tools that are actually fit into daily hospital routines and solve real problems. Third, empowerment and morale. Inclusion in the innovation process makes nurses feel valued and empowered. It boosts morale and prepares them to work with new technologies like artificial intelligence. Fourth, health equity. Because nurses work with people from all walks of life, they can help ensure that technologies are inclusive and improve access to care for underserved populations. Now, there's this evidence from COVID-19, sorry. A study by Mansour and Novus in 2022 looked at healthcare innovation during the COVID-19 pandemic. They found that when frontline workers, including nurses, helped develop tech solutions, those solutions were more relevant and got adopted much faster. In short, nurses bring the real world perspective that tech developers often lack. But of course, there are also challenges involving nurses more directly in health tech innovation. First of all is the lack of training. Many nurses don't have a background in technology or innovation, which makes it harder for them to contribute effectively without additional education. Second is structural barriers, where healthcare systems often exclude nurses from decision-making roles, which means their voices aren't always heard even when they have great ideas. Third is resource constraints. Heavy workloads and limited funding also make it difficult for nurses to participate in innovation projects. Many simply don't have the time or support. Fourth is resistance to technology. Some nurses may see technology as a distraction from patient care or worry that it could replace human interaction. And last is lack of authority. As noted by Al Salim and Al Wakil in 2024, nurses often don't have the institutional authority or support systems to turn their innovative ideas into action. So while nurses have valuable input, these challenges need to be addressed for their contributions to make a real impact. The the discussion concludes with a balanced solution. Rather than choosing between engineers or nurses, we should be thinking about how to combine their strengths. Here's what that looks like. First of all is education and training. Healthcare organizations should offer training programs to help nurses understand technology and innovation processes. Second is interdisciplinary collaboration. By creating teams of nurses and engineers, we can design solutions that are both technically sound and clinically effective. Third is open feedback channels. Ongoing communication allows nurses to give real-time feedback during the development and implementation of technologies. With this approach, we can develop innovations that are practical, widely accepted, and truly beneficial to patient care. To wrap up, nurses bring clinical wisdom, engineers bring technical skills. Alone, each has limitations, but together they can create healthcare technologies that are smart, efficient, and compassionate. So instead of asking who should lead, engineers or nurses, maybe the better question is how can they lead together? Thank you for listening. I'd be happy to um, talk about this topic more with you, and thank you.